What would you say to your physical therapist if they're sitting here?
Thank you for going through the hard things to help me go through a hard thing. Thank you for sticking by my side, for holding my hand, for holding my baby on more times than I can count. Thank you for being a friend during one of the hardest parts of my life. I am literally eternally indebted to their service and their time that they took to help treat me.
She has a unique postpartum story.
Before I had my son, I was really active. I was teaching classes at the gym. I was working out all the time. I was running half marathons. And then postpartum, I felt like I was a lump of nothing.
What would you say to our young moms that are pregnant?
I really hope they just see a pelvic floor therapist at least once.
Welcome to the Healthcare Revolution podcast. We are excited today to introduce Katrina LeCheminant.
LeCheminant.
Oh, there we go. And she has a unique postpartum story. And we want to be able to share that with the world and to our listeners. And she had really 6 different injuries after coming back from from having a baby. And each one of them very unique, and each one needed a different healthcare provider, and she had to navigate the healthcare system. What's unique about her is she started working in a PT clinic at a very young age, and got to learn about what healthcare is about and where to start with your injuries, and has helped her collapse time. So we want to share what she's learned through that experience on how to really collapse time for each one of you. So just a quick introduction of her. She runs a podcast for a very big group that we work with called Athelus, which is a huge group, a multi-billion-dollar company. And she gets on a lot of different leaders from across the healthcare spaces to talk about improving the healthcare experience. Yeah. And it's an amazing podcast that I've been a guest on, and so appreciative of what she's doing with her work there and having those conversations and really working to improve the healthcare system. So she does that as her main job, and she's also a mom, and she's experienced firsthand the transition from postpartum life back to motherhood and working life. So, Katrina, welcome to the podcast.
Thanks. So excited to be here. I'm really excited. This is going to be fun.
Yeah, so I'm so excited to talk about your story, and it's just it's unique, but at the same time, it's a lot of women experience what you've experienced.
It's probably a lot more common than most people think.
Yeah, and we want to collapse time for a lot of people here, and speed things up to where they can get the healthcare that they need and get back to the goals that they want to do.
Yeah.
Earlier, we kind of talked about how you're doing a lot of push-ups. Tell me about, and we had wrist injuries. You're doing push-ups now. Tell me what activities you're doing now that you couldn't do postpartum.
Oh, geez. I feel like, I will first start by saying I really didn't feel like my fitness journey. So but I'll backtrack a little bit. Before I had my son, who is almost 2, I was really active. I was teaching classes at the gym. I was working out all the time. I was running half marathons. I was like the peak of my fitness, right? And then
what age were you at that point?
I was 26, 25, 26, somewhere in there. Yeah. And felt like I was in the best shape of my life. Like I was exercising 2-3 times a day, just between classes and different things that I was doing in my life. Like I'm just a very naturally active person. And then postpartum, I felt like I was a lump of nothing. It's like I can't do anything anymore.
A lot of women feel like you feel like your body's kind of falling apart.
Yeah,
and
my body had changed so drastically during pregnancy. First off, I was really sick during my pregnancy. I was in a constant state of nausea all the time. I felt like I was 2 seconds away from throwing up at any given moment. And so that made it really, really difficult to be able to exercise and keep up with what I was doing before. And pregnancy also just changes your body in a lot of different ways. Like you're changing so much to prepare for this baby to come. And then after you have the baby, your body is like in a state of, okay, we just had this baby. Now we got to figure out how to navigate this. And so I lost track of what I was saying.
Essentially, you were just lost in all of this and through all these injuries. Let's pause on the journey that you went through for a minute. Tell us what you're back to doing now And then we're going to go into your journey a little bit more.
Okay. Back to what I'm doing now. I'm definitely running again. And we'll talk about all the issues that I had to overcome to get to that point. This year I set a goal to do at least 10 push-ups every day. I feel like it's really, really important for women to build strength and muscle, especially as we age. And so that's something.
What percentage of women can do 10 push-ups?
I don't know, but I don't know if it's very many, to be honest.
Yeah.
Like when I ask people or talk about how many,
I might have to look it up when we're talking. Because...
but it's so easy for women to lose upper body mass as they age. And now that, like a woman's lifespan, it's like 80 years or whatever it is, right? And so by the age of 40, you're already halfway there, and 40 doesn't seem that old to me. And so to the fact that your muscles start decreasing so drastically by about the age of 35, 40, it just has pushed me to really take care of my upper body. And also, like, I want to be able to, like, throw my kid up in the air, and I want to be able to, like, lift heavy things. And
you don't want to be dad getting that
no.
shot.
I'm like, mom's just does the cool things. So I've been working on doing push-ups and maintaining that upper body strength. And this morning, like, ironically, it was an upper body workout this morning, and we had to do single leg burpees. So I challenge you all to try that one.
I'm looking up as we're speaking. What percentage of women can do 10 or more push-ups? I'm asking for the source here, and this is just using ChatGPT.
Yeah.
But it's saying around 20% of women.
Oh, what does it specify whether or not it's like on their knees or on their toes?
It says it can do 10 strict push-ups with good form.
Yeah.
So on your toes.
I believe that.
So if
you
can do 20 plus, you're in the excellent category.
Yes.
If you're 11 to 20, that's the good category. 4 to 10 is average to moderate.
Okay.
0 to 3 is below average. So we got to make sure that's a good source that we're talking about here. Yeah, that's actually a really good source.
Oh, sweet.
These are just fitness norms.
Yeah.
And that's a really good source to look at. But yeah, really interesting. But so you're back active again.
Yep.
Right?
Back to.
Let's just list your injuries that you had for us before the baby, or when you were pregnant. You had this hip pain, right?
Yeah. So about 6 weeks before I had my son, I woke up one morning and I was in the most excruciating pain in my left hip. I think what it ended up being the determinant factor was my baby had dropped in preparation for labor and delivery, and was just pushing on all sorts of ligaments and nerves, and my muscles spasmed up to try and help support that side of my body. And I literally, I felt like I couldn't breathe. It hurt so bad. I was trying to walk and try to go to work and trying to stretch. I was doing all the things that I could think of from my experience in physical therapy, and nothing was touching it. And so I knew something was wrong. I think I had even briefly met with one of my coworkers who was a former physical therapist, and I was like, give me something, what is going on? Yeah, we tried to realign my hips, and that didn't help. And so that ultimately led me to thinking maybe this is something more internal. And I didn't have a ton of exposure to pelvic floor PT before. I had worked in an office where there was a pelvic floor physical therapist, but I didn't really know what the ins and outs of what they treated and what they did. So I just through the grapevine had asked some of my PT friends. I was like, hey, do you have any good pelvic floor physical therapists that you could recommend that I could go see? And thankfully I was able to find a really great, amazing pelvic floor therapist that was able to help.
Tell us what that experience was like, going to pelvic floor physical therapy.
Yeah, it was a little nerving, I think. Granted, I was pregnant, so you get used to having people poke and prod in all sorts of places. And so I'd started to get used to that, but this just felt like a little bit more intimate and maybe a little bit more scary, just because there was a lot of pain associated with what I was doing. And so going into this physical therapy space, we were in our own private treatment room. She was so kind and so respectful, and she just was very sympathetic towards my situation. She was asking me all the things that were bugging me, the things that were preventing me from doing, feeling healthy and feeling good in the last trimester of my pregnancy. And I just felt like she was really in tune with my needs and what I needed. And she was very communicative. She told me like, hey, I'm going to touch here. You're going to feel pressure here. I'm going to do this, and then I'm going to do this, and you may feel these sensations. She just walked me through the whole thing. So I never felt unprepared. I felt like I was right there with her, learning through that experience. And ultimately she was able to, do some pressure points inside my pelvic floor, found that there's some really tight muscles in the bowl of my pelvic floor that had seized up. We worked on dry needling my glutes that were rotating my hips. We worked on my low back, making sure that there was mobility there. She really helped me address all categories of like what could possibly be bugging me. And I truly attribute like all the success from my labor and delivery to a pelvic floor therapist. I had several friends who were pregnant around the same time, and every pregnancy is different. Everybody is different and has different experiences, different doctors, different ways that they want to labor and deliver. But my labor and delivery was so smooth. Like I got induced, I dilated really quickly. And then my son came out really fast. Like I only pushed 2 times and he came flying out. I had no tearing.
What did you learn in pelvic floor PT that helped you with delivery?
Yeah. So she really helped me learn how to breathe and relax my pelvic floor. And she taught me how to push through my pelvic floor. A lot of people tend to tighten up and, cramp and squeeze their eye, all those things. That's natural instinct to tighten up. But in reality, it's the relaxing and breathing through your pelvic floor and allowing that space.
If most people are just very foreign to this concept.
Yes. This pelvic floor therapist helped me. It was like mind to muscle connection. She helped me feel and like breathe through all of these different exercises to help me think, okay, like when I'm in this position, I'm getting ready to push my baby. This is what you should be doing. This is how it should feel. This is what you should be looking for. These are the keys to like help you relax in these moments.
What do you know about what most women do?
I feel like it's like the typical movie, like the screaming, like, just like trying to push the baby out. But for me, it was actually really relaxed. I was just like, okay, here we go. And out he came. Like, it's a great time.
And what happens in what you understand when women are tensing up like that in the pelvic floor?
It makes it so much worse. Like all you're doing, it's like pushing against a brick wall. Like you're not getting anywhere. And it's only causing you more pain and more harm in the end. And so I feel like rerouting how your brain thinks about things and how you've seen things perceived just on social media and movies, whatever it is, it helped me rewire my brain and to help me listen better to my body in those high intense moments. Like that's one of the most painful experiences I think. I don't want to say any human could experience because I'm sure there's worse, but it's up there. It's up there. And so to be able to like be prepared for that moment, it was game changer. And in tangent with that, the pelvic floor physical therapist helped me learn how to stretch all of the tissue down there in the perineum, and to help me be able to prepare my body for a giant head.
Why do you, from your understanding, why does that matter?
So a lot of people, it's that skin is it's really fragile, and if it's not prepared well, it will tear. And a lot of women do end up tearing, or they get episiotomies where they clip the skin to make room for the baby. It's kind of this, I think of the same thing as just muscle flexibility, right? If you can work on touching your toes every day and working on hamstring flexion, there's less of a risk of you tearing a hamstring or doing some damage when you're, jumping from 0 to 100, right? So I think in that same sense, like you just have to prepare all of those small muscles and tissue and get all of your body ready and prepared for a big event.
Hey, think about, just like a rubber band. We've all pulled a rubber band when it's super stiff.
Yep.
And then you start to pull a little bit more, and then it becomes very elastic, right?
Yep.
The goal with what we call perineum, which is the skin around the vaginal area, is to make it elastic, right? And you got to prepare that tissue for having a baby. Yep. Right? And working on those perineal type exercises to stretch that tissue is really important, or that's when you can have tears, right? Yeah. And a lot of women for the first time having a baby still have small tears.
Yeah.
But it significantly decreases the likelihood of tearing if you work on those types of things before.
Yes.
And then also learning how to use these breathing mechanics and appropriately relax the muscles.
Yep.
Because when you breathe, it allows your muscles to relax to allow the baby to pass through the birth canal.
Yep.
When you tense up, it essentially holds the baby in.
Yep.
So you're trying to push, but you're holding, like you talked about, pushing against a brick wall.
Yeah.
And then all of your energy
is out the door. Yep.
And then you get exhausted.
Yep.
And you're in labor for 25 hours, right?
I literally remember after I had just delivered my son, and my doctor was holding my baby, and she was like, I don't know if I've ever seen a first-time mom birth a baby that fast before. She was just so shocked that, like, I think in that moment, you know, after reflecting, I realized that there are so many first-time moms who go into that blindly, who don't get that time to prepare their bodies and to make that mind and muscle connection, and to, you know, it's just like preparing for a race. That you're obviously going to train, you're going to run, you're going to stretch, you're going to do exercises that, you know, prepare those muscles for running a long time, right? Yeah. So it's the same thing as having a baby. I think, like, even there's like some studies that show that it's like pregnancy or birth is the equivalent to running a marathon or multiple marathons, because you're using so much energy in order to do that. And so it's like, why wouldn't you want to invest a lot of time and energy
and train for it?
Yes.
Right?
And
like
literally train for it.
You're working through the different mechanisms, the mindset, the physical, the relaxation, what you're going to do with your partner, what your partner's going to play a role in all of this, if they are or not, right?
I don't know if my husband would ever be prepared for that. I don't think there's anything you can do to prepare someone for that.
Yeah, it's super fun, especially when you're on the same page. When my wife and I, the first time I was not in graduate school when we had our first baby, and I've learned a lot, right? Yeah. And now I do pelvic floor therapy with patients, and I've learned a lot along this journey, and I've realized there's so much you can do as a team, right? And that you really create an alliance between the nurse, your PT, you, your spouse, whoever that is, and your OB, right? Or your midwives. And when you all work together and you have the same game plan. Yeah. And maybe backup plans if the game plan doesn't work. Yeah. Yep. And you know what's going to happen if you get to that space, then everyone's good. Yeah. Right? And it goes so well, and you're able to stay relaxed. Yeah. And it could be a real challenge. But it sounds like you really had the best case scenario of delivery.
Yes. And I'm curious to see what it'll be like when I have my second baby, like what that process, like that labor and delivery looks like. But I truly felt like my body, like there was such a huge shift between before I did pelvic floor PT and after. It just made such a big difference in my overall birthing experience.
What would you say to our young moms that are pregnant and they've never done delivery before? What are you hoping that they go do?
I really hope they just see a pelvic floor therapist at least once, to just go in, just to, even if you're not in pain, I think there's just so many key things that a pelvic floor therapist can teach you about how to understand your body, how to understand what are the things that you're feeling, how to constrict those muscles, relax those muscles, to breathe. Like, just, I feel like there's so many things that people just don't know about their bodies. And so if anything, it's just a great educational skill to have in your back pocket and to keep practicing those things that you learn from them as you prepare to have a baby. I don't think there's any harm that could be done by gaining more knowledge and preparing.
Yeah, absolutely. Yeah, I love that. Tell us about postpartum now.
Oh, good night.
You delivered, and then we talked about one of the things, that hip pain, that nagging hip pain at 6 weeks before delivery. But then a lot of people don't think about what happens next, right? Yeah. You get home from the hospital, everyone's coming to visit, everyone's coming to share, meals with you, and it's so exciting for about 3 days. Yep. And then what happens?
And then reality hits you real hard.
Tell us about the things that moms don't talk about.
I was not prepared. I don't know if anyone really could. I think there were things that people would say, like, oh yeah, like, you might expect some postpartum blues, you might experience some anxiety, you might have this, you might have that. But I feel like until I truly experienced it and was in the trenches, I don't know if anyone really could have created that reality for me. So I'll start with a little bit with the mental side of things. So I have a history of anxiety. It's not crippling, but I do have a history of anxiety, and that peaked definitely during my pregnancy as our hormones changed. But postpartum, I had a lot of anxiety. I could not let my baby go. I had to have him with me at all times. Like, even if somebody was sitting next to me, someone who I loved and trusted was holding him, I was like, no, I need to have him back with me. Like, there was a weird separation anxiety there. So that was, it's refreshing a lot of emotions for me, because nobody could have prepared me for that. And then on top of all of that, like, your body feels like garbage. And then every single night when the sun would go down, I would just feel like the world was ending. I would feel so depressed and so sad. Felt like everything was out of my control. And that was also really scary, because during the day I was like, oh, I'm fine. Like, I can do this. I feel great. And then the sun would set and something would switch, and I just could no longer function as a human being. And it was really difficult.
And then you think about all the things that come on top of that, right?
Yeah.
Sleep exhaustion.
Yes, all the sleep exhaustion, and not really having a reason why I felt sad. There was never like a particular thing that set it off. It was just, I think they kind of equate it to the seasonal depression disorder, kind of like when it gets dark and cold. It's kind of that similar thing, but it just happens every single day, every night when the sun goes down. And that might be different for all women, but for me personally, it was when the sun went down. So that was really, really difficult to navigate mentally. I just was not in a good headspace. But then physically, like, I was tired, I was sore, I was, there was just a lot of, and I looked at myself in the mirror and I was like, I don't even recognize myself anymore. Like, I think as a pregnant mom, you're like, oh, I have this cute bump. Like, I'm obviously pregnant. Like, it's okay if my body changes. Like, I'm getting ready to have a baby. And then you have the baby and something just switches, where it's like, you feel like the world expects you to look like you were before you had your baby. They expect you to be at your
kind
peak.
Of the social norm.
Yes. And in my head,
it's almost like we create this imaginary audience, right?
Yes.
Because ultimately, I don't think moms are truly saying, like,
no,
you got to bounce back in a couple days, right?
If you talk to any mom who's had a kid, 9 times out of 10, they're going to be like, you take care of yourself first. Like, just take a breath. Yeah.
On it,
like, it's
slow.
Okay. Like, you have your whole life to be fit. Like, enjoy this time. Just give your body the grace that it needs, because you just went through this traumatic, life-changing experience. Yeah. And so,
and most research that we look at suggests that it takes 1 to 3 years, which is a very wide range.
Yep.
For the average woman to fully recover from having a baby. That's hormonally, that's your body elasticity, that's your body strength.
Yep.
So we got to give ourselves grace in that return process.
Yeah, because I'll be 2 years postpartum in the end of June, and I only feel within the last, granted, I stopped nursing about 8 months ago now. And even while I was nursing, like, I still felt like I couldn't quite get on top of my physical fitness until I stopped nursing. And only then has my, physical fitness journey has grown exponentially. And I feel like I can start running again. And I feel like but it's taken almost 2 years for me to stop leaking, to stop feeling like my bladder's going to drop out of my, it's taken so long. And I don't think I was mentally prepared for that journey. I thought that it was going to be like, oh yeah, like maybe 6 months to a year and I'll be good. I'll be fine. Yep. And boy, was I in shock when I was like,
and think
no.
About it, like, you were at peak fitness.
Yeah.
Right? Before having this baby. It's not like you were just a couch potato, right?
Yeah.
But you had, I think we talked about 6 things earlier. You had your hip pain, right? You had rectus diastasis, which is the separation in your belly. And then you had
a little bit of prolapse, wrist pain
on both sides.
Yep.
You had the prolapse, which is just the organs kind of falling through the vaginal canal.
Yep.
And then you had leakage.
Yep.
And then you also had pain with intercourse.
Isn't it pregnancy's such a fun time.
And we're like, why do we want to have more babies? I don't know. I'm just kidding. We love our babies.
We love all of our little babies. Yes.
But these are the challenges that come with it,
Yeah.
right? And then also you had the postpartum stuff.
Yep.
Right? You feel like the blues that you're feeling, like the emotional irregulation.
Yep.
Hormones were all over the place. You were feeling exhausted. You looked in the mirror and you didn't even recognize yourself.
Yeah.
Right? You probably felt that your body was not
even my own. Nope.
You almost feel like this out-of-body experience. You're like, that's not even me.
Yes.
Right?
100%.
And there's just this constant struggle of you're caring for this new child, but you're supposed to be caring for you, but you don't have time to care for you, and then you neglect you, and then you feel like crap. And it's just like this vicious cycle.
Yep.
And you get all these injuries and everything that hurts and everything that doesn't feel right.
Yeah.
So my main question to you is, where did you start, and how did you get out of this rut? Because sometimes we get so deep in that rut, and some women spend years and years and years, and some never really get out of it.
Yep.
So where did you start, and then how did you start kind of clawing your way out of this?
I will start by saying that one of the best things that I was told, I can't remember if it was from the pelvic floor physical therapist or if it was from my OB, but she said, just because it's normal doesn't mean it's okay, or common doesn't mean it's normal.
Yeah, it can be common, but not normal.
Yes. Yeah. And I think that really changed my frame of mind postpartum, because it just because I felt sad, just because I felt anxious.
Give us some context to that. And say it again for those who are listening. Say the quote, and then
just because it's common doesn't mean it's normal.
Yeah.
And when I heard that was more in reference to pain with intercourse, feeling like a bulging or heavy sensation in your pelvic floor, leaking when running, or just when you're laughing, coughing, sneezing. Leaking is not normal. Just because that happens to a lot of women doesn't mean that should be the case.
Sometimes women talk about it like it's normal. It's like,
yes, they're like, oh, I can't jump on the tramp, I might pee my pants.
They make it like this cute thing, and you're like, you can fix that, right?
Yes, exactly. And I think that kind of became my motto for my postpartum journey, because I think that my goal going into postpartum was to come back stronger than I was before I had my baby. And at the time, pre-baby, that looked different than it does post-baby, but I'm really proud of the journey that I've had so far. So it kind of just started with, as the symptoms grew for different reasons. So I did have a little bit of prolapse, a little bit of diastasis recti, and then I also had leakage when sneezing, coughing. I wasn't running that soon after having a baby. And so I knew that those things were common, but they were not normal. And so I went into a pelvic floor physical therapist, and I said, hey, these are some of the experiences that I'm having. Let's work on it. I know my body just got stretched so thin. Let's work on bringing and strengthening everything back up. And so I had a really great, a second pelvic floor physical therapist who helped me retrain my body, help rebuild that mind muscle gap in a different way with a different mindset. Helped me work on just all, you think that your pelvic floor is mainly just your hips, right? Or your pelvic floor organs, but really it encompasses your glutes and your deep core and your abdominals, that. It's very encompassing. Everything works together in that area. And so I started with that. And then a few months after postpartum, I started having excruciating thumb pain that ran up the side of my forearm. And I was like, okay, well, here's the next problem.
And that's a big frustration for postpartum women, right? It seems like you fix one thing and then
something else breaks.
Something else, right? You just feel like you're constantly fixing what's broken.
Yes.
And it can be kind of debilitating at times because you're like, I'm sick of going to appointments.
Yeah.
Right?
And it was hard to balance.
It's so easy to give up, too.
Yeah. It's hard to balance, especially if it's one thing to have one kid, it's another to have 5 kids, And so taking the time consistently week after week of either finding childcare, doing it on a time when my husband could be home, or bringing the baby with me. That was actually what I ended up doing 9 times out of 10. I would end up just bringing my baby in his car seat and trying to feed him or do whatever in between exercises or whatever it was. But I knew from my previous experience that this was going to be the best investment I could make to be the best mom that I could be. If I didn't take care of these things ahead of time, it was
a good quote. I love that.
It was only going to set me back more going forward. Like if I couldn't take care of my pelvic floor issues, if I couldn't take care of my wrist pain that was basically preventing me from holding my baby and nursing him, like it would change the trajectory of what I wanted my motherhood postpartum journey to look like. And so I knew that this was a good investment to make. It was worth the sacrifice to come in for an hour or two once or twice a week, because I knew ultimately that would make my journey a lot easier going forward.
Yeah, absolutely.
And so, but yeah, wrist pain was really horrible. It ended up being de Quervain syndrome. And I worked with a great team. We addressed everything we could think of to help me.
On the conservative side.
Yes, on the conservative side. And ultimately we did imaging and just decided that.
So you started in PT, you started in the right route.
Yep.
And then PT wasn't working, got some imaging.
Yep.
And then what from there?
And then I met with an orthopedic surgeon, and I had seen him for some other previous injuries that I had had. And he ended up doing cortisone injections in both my wrists. But we worked together as a team. I worked with my physical therapist and I worked with the orthopedic surgeon. And we ultimately came to the decision that in that stage of my life, I couldn't go 6 to 8 weeks with no movement in my hands. Like I was working, typing, texting.
To get de Quervain syndrome down, the irritation is the tendons need to be offloaded.
Yes.
Can you tell a mom not to lift?
Yeah, like to literally not use her hands after she just had a baby.
You can't breastfeed.
Yeah.
You can't move your thumbs.
You can't do anything. And it was just so...
And it's not necessarily like all rest. It's just taking a load off to allow that inflammation, that irritation to go down.
Yes.
And that's why that cortisone injection works so well for you.
Yeah.
Is because you literally injected cortisone into the tendon that was irritated.
Yep.
To decrease that inflammation.
We just had to hit the reset button on those bad boys.
Just calm that down.
Yes.
And you numb it. You essentially cut off the communication to it of the pain signal you're feeling, decrease the irritation, and then you start to gradually increase your load again.
Yep.
And that's what I loved about what you were doing is there was a team effort there to really figure out the root cause.
Yeah.
And get you back.
And it wasn't like one was holding me back from the other. One wasn't pushing, to avoid one or the other. It was both doctors communicating and saying what is best, what is ultimately best for this patient, what is going to get her to her goals. And I felt so lucky to be surrounded by doctors that ultimately just wanted what I wanted. They wanted to they wanted to use their skill set to help me in the best way that they could. That's and so awesome. I loved that part of my experience with them for sure.
Is there anything else about that journey that we should discuss that women should know? And don't worry, men, we're coming for you. We're gonna have Katrina give you all the advice, especially you young dads. Like you're watching your wives, they're pregnant. Yeah, you don't got a baby yet.
Yeah.
What should you be aware of? How can you support your wife through this crazy journey?
Just know your wife might go a little cuckoo for a few months, okay? But she's still in there.
Anything else we got for the gals? I want to hear something real heartfelt, Katrina. What's the message to these young gals that are sitting in these moments, this moment of just emotion, and they're just frustrated, and they feel like they're stuck in this rut? What advice do you have for them?
I just hope that all women feel worthy of good care. I want all women to recognize that a life of pain is not a life, and it's not one that you have to have. There are so many wonderful providers out there who can work with you in your specific situation to help you get back to the goals that you might not even realize are possible. And I'm so grateful that I took the time to invest in myself so that I could be the better version of myself, like I said previously. And I think a lot of moms don't think they deserve that or don't have the time to do that. And I think investing in ourselves during the most vulnerable state of our life is the best time spent. Truly.
I completely agree.
Yeah.
And I think you hit probably the most important thing that women feel, and that is that they don't feel worthy.
Yeah.
But I just want to add to that women, I hope you know how worthy you are.
Yeah.
And there are so many great healthcare providers that are in your corner.
Yep.
If you need great healthcare providers, call me personally.
Yeah.
Like, we will find you the best healthcare providers out there. And this world does not go around without you.
Yeah. Yeah.
And I hope you take care of yourself in the way you want your daughter.
Yes.
Or your son to take care of them.
Yeah.
Because you will demonstrate, you'll model for them what it's like to take care of you.
Yeah.
And they will do, most likely, what you have done.
Yep, exactly.
And it's so important. Another article I was looking at said specifically that kids, their likelihood of exercising later in life was directly correlated to if their mom did it as well.
Yeah.
It was an extremely high percentage of them modeling that behavior later in life if they watch their mom do it.
Yeah.
And it's pretty incredible.
That's why I love working out with my son. I mean, he's 2. He's not really working out, but he watches me, and I feel so empowered and so proud to lift some heavy dumbbells up and above my head, to do burpees, to do push-ups, to show that, like, just because I'm a girl doesn't mean I can't do strong things. Mm-hmm. And so it's so fun to see him, and he's recently started obviously I've been working on my push-ups a lot this year, and he has started doing kind of like pretend push-ups. Mm-hmm. And I'll just be like, Mama, watch. And he does his own little push-ups, and it just like warms my heart to see that, like, because I invested in the time early on when he was a baby, I can be a good example to him now, and I get to run around and play with him, and I can jump on the trampoline with him, and I don't have to worry about peeing my pants. And so there's just like so many aspects of things now that I'm like, I'm so glad I did that then so that I can enjoy this time now.
Yeah. Now you get to jump on the tramp with your son.
Yes. For better or for worse, right?
Okay, we're coming to you men now. This is if you are a gal and you're listening to this is when you shift this podcast to your husband.
Like, honey, listen to this.
Especially the ones that your wife is pregnant right now.
Yeah.
And you're just trying to figure out this journey. This is what we want to tell you.
Yeah. I would say it never hurts to do more, to take on more things, to take an active participation in the home workload. I don't know what every dynamic looks like, but I know that I had to sit down with my husband and just be like, hey, like, I physically cannot do this, so I need your help. So number one, when your wife comes for help, take it very, very seriously. And to step up and to like take an equal, if not more than equal workload. I think another thing is just to be present. I think that was something my husband was really, really good at. He put his phone away. He put distractions away. He spent time just being present. And he spent time sitting next to me. When I was crying, he would hold me and he would just listen to me. He didn't try to fix it. He didn't try to tell me that I was broken. He didn't try to tell me that, oh, it'll be over soon or it'll get better. He just held me in those moments, which was so empowering for me. And during my pregnancy was, I think it's the same concept, just listening, holding them, knowing that this time will pass, that, life will move forward. But in these moments, it's just, you need that support, someone to just listen, someone to be in your corner, to not judge you, to not try and push you to do something outside of what you feel like you can do.
Yeah, ultimately, as men, we're fixers, right?
Yes.
I think we all know that. The majority of us know that. But when your wife comes to you with these problems, say these 6 problems that we've been talking about, you just want to solve them.
Yeah.
You're just like, well, just get up and move. Right?
Yeah.
Like, just get to these appointments.
Yeah.
But most of the time, it's just validating.
Yeah.
It's just sitting there, listening in the moment and saying, I'm here.
Yeah. And I think, too, is creating time and space for your wife to take care of herself, saying, hey, I'm going to take the baby for an hour. You go on a walk. You go on a drive. You take that time to go to a physical therapy appointment. Go get a massage. Go to, like, whatever it is, to like allow them to have that time for self-care, self-reflection, a minute to breathe outside of, I think sometimes we get, at least for me personally, I felt so consumed by like nap schedules and feeding schedules and cleaning bottles and taking care. Like, I felt so consumed in that cycle that when my husband was like, hey, I'm going to take this for a minute. You go enjoy the silence. You take care of yourself and then come back.
Most likely, I love that you say that. Most likely a new mom probably only trusts you with that baby.
Yeah.
Even over their own mom.
Yeah.
It's really interesting dynamics. And by you saying that verbally, like, go on a walk.
Yeah.
I will be here.
Yeah.
And giving her that time is super critical.
Because I'm speaking for most moms, not all moms, but most moms, they're not going to create that time for themselves without feeling guilty.
Every excuse.
Yes.
Yeah, and the guilt is.
Or if they do,
level.
they just the whole time they're like, I am the worst mom. I just left my 3-day-old baby, and what am I doing?
Yep.
So it's just having someone.
I went on a walk,
Yes.
and now I feel terrible.
Yeah.
You're like, you think that baby wants you to feel terrible?
No. They
You
want
think
you
that
to be
baby
the
wants
best
you to
version
take
of.
care of you?
Yes.
Like,
yes.
you take care of yourself. You want to model that? You go do it. Go model it, and don't feel guilty about it, right?
So it's having some, like, your spouse coming to you and saying, I'm giving you time. Go do it. Because I don't think we would do it otherwise.
Yeah.
Truthfully.
All right, we're turning a little bit here. What advice do we have for our mama friends? How do you support your moms? You got this huge community of moms out there.
Yep.
Like, how can we support each other? What did you see in your postpartum recovery that was helpful from your friends or your community that you would give to our listeners?
I think it was a big one was check-ins, just texting randomly like, hey, I'm thinking about you. How are you doing? How's your mental health? And sometimes when I would text my friends, I would explicitly say, don't say you're fine. Tell me how you're really feeling. Because I think it's so common for us to just be like, oh, I'm good. I'm doing better. Like, it's great. But behind the scenes, I'm like, I'm dying.
Especially for someone like Katrina. She's so bubbly and she's so fun. No one would ever know that she was just like at night
sobbing every night to sleep. Yeah.
So from the outside, we portray this message, right?
Yes.
But ultimately, we need to check in with each other.
Yeah. And I've done that. Like, I've seen my younger cousins. They've just recently had babies. And I've texted them like, no, for reals. Like, how are you doing? Like, what does your mental health look like right now? We've talked about, the postpartum anxiety. We've talked about intrusive thoughts. We've talked about postpartum depression. Like, all of these things I've been trying to put a name to for them so that they can see like, oh, it's common. Like, this happens. Like, it's not some like thing that I'm only experiencing and I can't share with anybody else because it's fine. It'll be over soon. I want all
Almost
of my
everything that you're going through
is normal.
Common.
Yes.
Like,
yes.
they all.
I'm pretty sure I saw a reel during my like pregnancy postpartum time that it said like pregnancy is like you'd go to your OB and you say like, oh, I've been pooping frogs lately. Is that normal? And they're like, oh yeah, it's totally normal. Happens to everybody. Like, that's literally what it is. It's like, I think that our symptoms we write off as, oh, it's fine. Like, I'll just tuck it in the back corner. But in reality, 9 out of 10 women are experiencing it. It's way more common than we think it is. And so I
think I love that you say that. Like, but I don't think we talk about it enough.
No. I mean, I was talking to my cousins who are younger that, I feel like as the generations get younger, we become more open and communicative about the things that we're experiencing. But even for them, they were like, no, I'm okay. I'm fine. Like, I'm doing great. And then when I pulled her to the side, I was like, no, really, how are you doing? And she's like, it's awful. Like, I have such intrusive thoughts. I'm so scared that I'm going to accidentally drop my baby or hit his head every time I walk through the doorway. I cry every night because I'm so sad and I don't know why. And I have like extreme anxiety if my baby's not right with me. Like, there's so many things that I was like, it's okay. Like, it's normal. And it's normal to ask for help. It's normal to tell your doctor, hey, I'm experiencing these things. It's okay to go on medication for a short period of time as you're adjusting to this new life change and the hormone changes.
Hormones are all over the place.
Yes, I'm like, it's okay. Like, it's totally okay. And I just want to be that person. Like, I hope all the women listening, it's like, be that person. Like, you have to make that decision to be that person for somebody. And you have to go out of your way to text people and ask them how they're doing, swing by, drop off a meal unprompted. Like, women just don't ask for help very often. And so as another woman, I'm just like, I know you're not going to ask for my help. I know you're not going to tell me when you're losing your marbles. Like, I'm just going to come. I'm going to sit with your kids. You can go up and nurse your baby in silence. You can do whatever. Like, if you can go take a shower, I will sit. I really just want to be that person for people because you'll never ask for it.
Yeah. Imagine if our whole world was that way. Like
I know, right?
Every one of us was looking out for each other in that way and just checking in.
Yeah.
It really makes a strong impact.
Yeah. I think just like the little things, it goes back to like the fundamental basics of human life. Like the little things go so far, especially in postpartum. Like all those things matter.
Yeah. I love it. Tell us, as we kind of wrap things up here, tell us, what do you hope all of us should know? Well, actually, what do you think should improve in the healthcare experience? Like your podcast is all about this.
Yeah.
And you've learned a lot in this area. What do you hope really changes in the next 5 years?
I really hope that there is a standard of care of just educating women when it comes to pregnancy and postpartum. I think we've done better. I think we've done better, but we can be a lot better. We could be a lot further along in this process. We're starting to open up and talk about, mental health and all those things, but I just don't know if there's quite a level of care that exists or that is the standard of care. I would love to see that pelvic floor physical therapy is just part of seeing an OB. Like instead of just going and seeing a heartbeat and leaving, like I would hope that an OB would be like, hey, okay, it's time to go meet with your pelvic floor physical therapist. Let's prepare you for this birth of your baby, whether you want to do it natural, whether you want it epidural, like let's work together to make this the best experience ever. And the same thing with postpartum. I would hope that it was a standard of care to maybe even meet with a therapist to talk about all of those things, to have pelvic floor physical therapy, to work on retraining those muscles and having like, it's the same thing with like a pediatrician appointment, right? For your kids, you have one every month for a certain of time, and then it's every 3 months, and then every 6 months. Like
get a standardized.
I would hope that would be the expectation for the moms as well. Like to go and check and have a pelvic floor physical therapist, have these standards of like, okay, by 2 years, like you should be able to start running again, or to not feel like you have to leak, or whatever the timeline is. Like there should be levels and like a very scripted way of taking care of.
We're working towards those ways. Right now we're working with 2 different OB groups to where we are doing what you're saying. And a lot of the reasons why these are changing is because women are choosing to speak up. Women have silenced themselves, and they have been silenced by society in a sense. Where they feel ashamed. Right? So they just hide these things. And we can't fix systems that society doesn't know about. And the louder your voice in a very kind way can be really helpful to know where we should go.
100%.
And so many more women are talking about these things, and it's so helpful because...
Well, I think too, like I think with social media and the internet, like there's just more out there. So you can see like, oh, there is a treatment for like C-section scar recovery, or we can do some manipulation.
So much more education.
Like there's just so much more out there. I think some people just quite frankly don't know that there is a solution to this. They just think that it's like, well, this is part of life, And so I think that, like the more we share from an educational standpoint, I think we can really standardize that care. And I think overall just make this experience way better and way more efficient, and overall just like put the power in our patients, right? Or within these moms.
I love that. Okay, 2 questions to wrap up here.
Okay.
Number 1 is, how has physical therapy helped you through this journey? And what would you say to your physical therapist if they're sitting here?
Oh, you're going to make me cry. Gosh, physical therapy has changed everything for me. It has completely changed the way that I live my life. It has changed my relationships with my family members. It's changed the relationship I have with my baby and my husband. It has just I feel like I have so many tools in my toolbox to tackle any health problem that comes my way. I feel like instead of resorting to like surgeries or pain medication or whatever, I feel like I have the ability and the power to help fix my own body. And I can, I have that power to do that. I don't think I have adequate words to describe like how it's changed my life, and the people that I've met, the people I've worked with, the people that have invested in my life and in my care and my overall well-being. But to like the physical therapist that I've worked with, it's just thank you. Thank you for going through the hard things to help me go through a hard thing. Thank you for sticking by my side, for holding my hand, for holding my baby on more times than I can count. Thank you for being a friend during like one of the hardest parts of my life. I am literally eternally indebted to their service and their time that they took to help treat me and address the things that I was really struggling with. My life literally has completely changed because of the time that they've spent with me. So just extremely, extremely grateful.
It's so cool to see moms thrive. Moms really make the world go round.
Yeah.
You know, that quote of the one who rocks the cradle changes the world.
Yeah.
And that's really what our moms do, is they really make the world such a better place, and we're so grateful for them. Mm. And I hope every mom that's listening to this knows that you're worthy.
Yes.
Worthy of exceptional health care.
Yes.
And that we are all here to back you up. Yeah. We're all here to support you. And even though you feel completely alone, there's a team, there is a community, there's all of us here to assist and lift you up. Yep. Please reach out to people.
Yep. Invest in yourself.
Invest in yourself. Invest in other people. Lift other moms. And dads, validate.
Good luck.
Hold your wives close.
Good luck. Hold on tight.
It's a roller coaster. And you know, even knowing they feel crazy sometimes, and you might feel that they're a little crazy sometimes, that's very common. Yeah. And very normal. Yeah. And there is better days. Yep. And the life of parenthood is very good.
It's so fun.
There's so much reward. Yeah. And where there's challenge, there's always reward. Yeah. And so much growth. And there's so much joy with it, too. Yeah. You hit some of your lowest lows, but your highest joys.
Oh, yeah. 100%.
And, you know, the life of being a parent is just, it's such an emotional roller coaster, but so rewarding. Yeah. Yep. So, Katrina, thank you for sharing your story.
Thank you.
Thank you for going out and changing healthcare and working on it every day and sharing these conversations. It makes a meaningful impact.
Yeah. Thank you so much. I really enjoyed this time.
Appreciate you being on the show.
Yeah.